This is Average Joe PT. We're here to work on reducing pain, reducing anxiety through education, and improving overall function. Now today, Scully and I, we're going to talk about neuropathy and ways at home that you can reduce your pain with neuropathic symptoms. Stay tuned. Now Scully and I, we're going to talk tonight about neuropathy. Different types of neuropathy like stroke-based, TBI, traumatic brain injury, also known as patients who have diabetes, who've had chemotherapy, pharmaceutical-based, or what they call pseudo, where they really don't know where your neuropathy is coming from. Now those are like the numbness and burning and tingling sensation that you have. It can be in your hands and feet. We're going to talk specifically more about the feet because that seems to be the general public consensus about where they're having their symptoms at. Now they can have them in their hands, but a lot of times most of the time they're having it in their feet. So but if you want to leave some comments down below, you want me to talk about some hand treatments, I can. But today we're going to address the feet. We're going to do a TENS unit again. Scully and I are going to go over that a little bit. We're going to do some Epsom salt and some other specific types of treatments that you need to do when you have neuropathic symptoms. Here we go. Now, when it comes to something as simple as Epsom salt, warm bath treatments to help reduce the overall pain and neuropathic symptoms, you want to use lukewarm water. Now, how do you tell you got neuropathy? How are you going to feel it in your hands and feet? All right, simple test is when you want to give milk to a baby and you've warmed the milk up, you do the inside part of your wrist. Come right down here and you just kind of feel that if it's lukewarm and you're not burning yourself, you can pretty much guarantee that you're not going to burn the bottom of your feet. Just make sure that that's just lukewarm, because that's the last thing you want to do is burn the bottom of your feet. But this will help your symptoms a little bit. It'll also warm up the tissue because we're going to do some stretching also with this. So let's go ahead. We're going to get our nice little towel here, put our foot right inside here and give ourselves a nice little foot bath. Ooh, that's nice. Ain't that nice, Scully?
I wish I had some feet.
Yeah, you're hoping you had feet that you could do this too? Well, I guess you can't have everything, Scully. So, needless to say, we're gonna soak our feet here. Just nice. You shouldn't see any redness, okay? From your skin. Just nice lukewarm water. Don't be going and turning this water up to the point where you can, if it feels warm, because you're probably gonna burn yourself. That's why you use the old wrist method. Just go to where it's warm. You're gonna soak it there. Nice little soaking. Okay, you know, kind of like what they do with pedicures, but you're gonna do it yourself at home. Guess what? It's free. Average Joe, we're all about keeping this simple. That's the simple thing to do with some nice little Epsom salt. Now the next thing we're gonna do, we're gonna take our foot right out of here and we're gonna dry it off for a second. And when it comes to neuropathic symptoms in your feet, you gotta check your feet. Now, if you're not as flexible as I am, because you're not lucky enough to be as young as I am anymore, like you once were, all right? You might need to use a mirror or have a family member come and look, but you should be looking at your feet on a daily basis. Something as simple as an ingrown toenail, if you can't feel it, it won't take no longer than a couple days, and next thing you know, you have an infection in your toe. It can get really serious from that point and really scary. So something as simple as an ingrown toenail that, because you can't feel it, gets inflamed, tears into the skin. Next thing you know, you have an infection. So make sure you're checking your feet on a daily basis, all right? And making sure that you see your foot doctor, or also known as podiatrist, so they can clip your nails. Don't be trying to clip your nails by yourself, because that can also, since you can't feel where it's actually being clipped at, you could really do some serious damage and have a big problem. So those are some simple techniques that you can do in making sure that you're having good foot care on top of reducing your neuropathic symptoms. Now, we talked about that stretch. You're just going to take that towel that you dried your foot with. You want it fairly long so you don't stress your shoulders or your neck at all. And you're just going to come and put your foot right in there and get a nice little pull in the back of the leg. Like always on all my videos, you're going to hold 15 seconds, 30 seconds, and then relax. Then you're going to come up and repeat. You should feel a pull on the back of the leg here, and you might also feel it in the calf a little bit. Now you can raise it up towards the toes and start to get a little bit more stretch through what we call the plantar fascia or the bottom of the foot. That'll also help a little bit. After that, what you want to do, you want to take the towel and just kind of roll it out. Get a nice little roll out. Ain't that right, Scully?
I don't care. I ain't got no feet.
Yeah. You ain't got no feet. I understand that. We'll get to you. Now, I'm going to come into view here and you can see my foot a little bit. Alright, and all you want to do is just start to curl your toes and try and get some of that mobility back. Just try and curling the towel. Now, you might have to loosen this up. I'm on carpet. It's not as easy. If I was on linoleum or tile or something, it'd be a slide. But you're just going to gently curl your toes and pull that towel towards you, and then you'll straighten it back out. And then you rinse and repeat and do that like 15, 20 times. That'll help at least get the joints in your toes moving, and then also hopefully strengthen them up over time. Now this is something simple you can do at least 3 or 4 times a week, and so you're kind of getting a nice little soak, you're working on stretching, you're working on mobility of your toes, as well as doing foot care. So we're going to talk with Scully next about good old fancy TENS unit and what you can do in your foot to help your neuropathic symptoms in regards to some TENS unit. Stay tuned. Now, Scully and I, we're going to talk about TENS unit. Now, just like before, we're going to put it on Scully. Scully loves the TENS unit, don't you, Scully? You're putting this on your feet. We're going to put one on me and one on Scully. That's an idea, ain't it, Scully? He don't want to talk right now. He's just excited about getting this TENS unit. So we're going to put 2 pads on him because he loves it. For some reason, he likes to have it on a temple, don't you, Scully? He's crazy like that. And we're going to put 2 on me. Now, when you put it on your foot, you want to put maybe 1 on the top. Make sure you got a little meat, a little fleshy, and then 1 on the bottom. 1 on top, 1 on the bottom. We're going to plug it on in, aren't we, Scully? And what you should feel is a gentle vibration to this. You're not going to have any pain with this at all. You're going to turn up, you feel a nice little buzzy sensation. Sometimes these tiny little wires can get really twisted up on you. So you're just going to plug it on in, and this will help block and modulate some of that pain that you're having, like we talked about in last episode. If you want to look at that, that goes over just chronic pain, and I'll leave a link up above that you can look at in regards to chronic pain. So when you turn it on, like I said, all the switches, most of these units are basically switch based, and when you turn it on, you can hear this. That little dink sensation, and then we turn it up to woo. I feel it now, boy. Woo, that's a little buzzy. So you only turn up, you feel a nice little buzzy sensation. And this you can use multiple times throughout the day. There's no real contraindication or reason why you couldn't use this. Obviously, if you had some sort of wound on your foot or something, you wouldn't want to do that. But for just pain, put it on there. You can leave it on there for half an hour, Some of these have little settings that you can leave. It'll turn on for maybe a 20-minute timer, a 30-minute timer, and it'll turn off by itself. Just don't fall asleep with this thing on. All right, don't want to do that. What do you think about that, Scully?
I love my TENS unit.
Yeah, you like your TENS unit, I know. You like the electricity around your head, I'm seeing too right now. I see that crazy electricity. He loves the TENS unit. All right, we're going to turn it off. We're going to turn it off, Scully. That's enough for you. All right. So, if you have any questions about the TENS unit, just leave comments down below. Like I said in the last episode, this thing is like 15, 20 bucks at the most, depending on how fancy you want the gauges and stuff. This is gold, especially for people who have neuropathy, chronic pain. Like I said, these things used to be $600-700 with a company called Empy. forever and ago that they went out of business, and now you can pick them up for practically dirt cheap. I mean, going from $7,800 to $20, $25 is a dramatic reduction, and they're gonna last forever. I mean, this thing I've had for several years myself. This is a 7000 series. So if you want any ideas on that, I can go ahead and leave a link down below. Maybe I'll do that. That way you guys can go ahead and look at it online if you want and purchase it. And so that's the Simple Tens unit. We're gonna go ahead, we're gonna do a few more things. Don't go nowhere. So those are the neuropathic treatments that you can do, Scully and I, looking for you 3 to 4 times a week, working on those feet and reducing those overall nerve symptoms. Now, subscribe down below. Scully and I would love to have you guys in our community. Ring the call bell so that way you can see our new content coming on a weekly basis. And if you have any comments, go ahead and leave them down below. But until next time, I want you to look up and keep smiling. Ain't that right, Scully?
Look up and keep smiling. Seriously?
Yes.
Fine.
One of these days.